You're watching Capitol Conversations with Congressman Mike McIntyre, an opportunity for the people of southeastern North Carolina to get an inside look at the issues facing the nation and the U.S. Congress. I invite you to see how your community is affected. Now, from Washington, D.C., here's Congressman Mike McIntyre.
Hi, welcome to Capitol Conversations. I'm Mike McIntyre, your congressman from southeastern North Carolina, and this program is part of our ongoing effort to keep you informed about what's going on in Washington and how it affects all of us back home. Today I'm here with Elizabeth Goolsby. She is the director of the Fayetteville VA Medical Center, and we're going to talk about services for our nation's veterans. And there are many exciting things happening right here in southeastern North Carolina. Last spring we opened the nation's first standalone VA dialysis clinic in Fayetteville. In August, we opened the Brunswick Veterans Clinic. And in September, we broke ground on the Wilmington Super Clinic. And how exciting it will be next December, when just before Christmas, we should be able to open the new Super Regional Clinic that will serve a 6 to 7 county area in southeastern North Carolina. We also have expanded services in Robeson County, and today, our guest, Elizabeth Goolsby, as the director of the Fayetteville VA Medical Center, has had broad experience. She's been the director in Fayetteville since July of last year, but her first stint in North Carolina started back in 1970 when her second Army assignment brought her to Womack Army Medical Center as a nurse. Her VA career has spanned 30 years, and she served in numerous positions of leadership, including nursing, teaching, and administration. So we're thrilled to have you, Ms. Goolsby, to be with us today. I know we've been together at all of those occasions I mentioned back in the district, in Robeson and Brunswick and Cumberland counties. And we've also were in New Hanover recently for the big groundbreaking of the super clinic to be located at the Wilmington Airport. We're proud of the work you've done. I especially want to say thank you for your not only commitment, but your enthusiastic commitment, because I know there's been a history of some issues, unfortunately, in years past at the Fayetteville VA Center. But I think you've brought a refreshing new attitude and atmosphere that has been readily visible to those who are being served there, and I know you have a desire to continue to make improvements as we go along. So I want to ask you, our first question would be to give us your overview of the VA Medical Center in Fayetteville, the services it provides, and how you see the particular facility in Fayetteville itself improving, because I know through the years we've dealt with a lot of concerns from the constituent side of things with veterans, and I know there had been a great desire to improve that facility, and like I said, I believe you're starting to make a real difference there. So if you'll just share with us kind of your perspective, first of all, on the Fayetteville VA Medical Center and how it serves our entire region.
Oh, thank you. It's absolutely a pleasure to be here with you today and to talk about the wonderful things that are going on at the Fayetteville Medical Center and all of our community-based outpatient clinics. At the medical center itself, we're undergoing a lot of construction. Our emergency room was able to accommodate about 5 patients at any one time. We're now about halfway through a major construction project which will increase it to 10. We will also have state-of-the-art electronics, state-of-the-art telecommunications, so that we can continue to care for our veterans. And in caring for our veterans, we are caring for 50,000 veterans in Fayetteville as well as our community-based outpatient clinic, and have had 550,000 outpatient visits last year.
Wow.
When you think back,
say that number again.
550,000 outpatient visits last year. That is double the number of patients we saw 10 years ago, and it's 3 times the number of outpatients we saw 10 years ago. So the growth is incredible. But we have much to do, and we're continuing with a focus on women's health. Our Women's Health Pavilion is under construction. We should be able to open that by the end of the year, as we have probably about 12 to 15% of our patient population is now women, and we expect that that's going to continue as evidenced by what we're seeing in the military. And we have a comprehensive program for our women, not only with primary care, but we have a full-time gynecological surgeon who's able to help take care of the needs of our women. And I think that that's a tremendous boost and a tremendous tribute to our commitment to our women veterans. We also are building a new mental health unit, and we were able to free up an entire unit, gut the entire unit, and build a mental health unit that truly bespeaks the care and services that our veterans need. It's about halfway finished, so we should be able to open it in the spring. And then when we finish that, we'll come down to each of the floors and gut those floors and make private baths and private bedrooms for every one of our veterans. The facility was built in 1939, and we did not have kind of technology. We're not able to even dream of the technology that we have now. So we need to go in and change our infrastructure so that we can support that technology. And this will give us the opportunity to do that. The programs at the medical center are also increasing in terms of services we've not provided to our veterans in a very long time that we are going to be able to provide, and that's in the area of medical oncology. We've not had a medical oncology program for a very, very long time at Fayetteville, and we're starting with a 3-phase project, opening an infusion center which will be available this fall, and we will be able to start with doing hydrations, blood transfusions, interferon, those kinds of therapies. The second phase will be a collaboration with WOMAC and with Durham VA Medical Center in order to have the beginnings of a chemical medical oncology program. That is, we'll be able to administer the medical aspects of oncology in collaboration with having a center here in the Fayetteville area, as well as having communications with the experts at Durham so that we can provide those services closer to home. Because our veterans now have to travel a long, long distance to get that.
Well, and when you talk about Durham, I know my father-in-law's been to the Durham VA Center as well as the Fayetteville, and I know that it's right across the street from Duke Medical Center, and Duke is renowned for its work in fighting cancer.
Yes.
And so when you speak of oncology and the services that are being offered there, some of those Duke physicians, as I recall, also come across the street and work as an as-needed basis, or maybe it's a contractual basis. Maybe you can enlighten us on that, but they work with the Durham VA. So when you talk about accessing the Durham VA, we're talking about also, in reality, accessing the services that Duke combines or collaborates with the VA on. Is that correct?
Oh, absolutely.
Right.
Absolutely. Yes, we will be, by using the Durham facility, we, by extension, use the physicians from Duke. So it will be a collaboration.
Yeah. That's excellent. And now you mentioned the growing number of women's veterans, and I know we are just coming off of Breast Cancer Awareness Month in October. And also you speak of oncology. We know prostate cancer is growing in awareness.
Yes.
Is becoming more to the forefront of discussion now because of how it literally can sneak up on men and not realize they even have the problem because the symptoms are not readily apparent. So in terms of your oncology services, this is an area that you can reach out broadly when it comes to cancer care, from what you're saying.
Absolutely. Now, we will not offer the radiation therapy.
Okay.
That still is something that really needs to be done in Durham for the foreseeable future. But the medical oncology portion, we feel we can do, that it provides a continuity of care for our patients that they need, and we think that this will be a tremendous boost to the area in terms of that continuity and that ease of access.
Well, and by opening the door or having a broader avenue for oncology services, those who are suffering from cancer can realize that that's something that's available,
yes,
and they can enter into that continuum of care, so to speak, right there in Fayetteville. And that I think is an exciting prospect to have that availability closer by, as you said. Now, you serve a 21-county area, is that right?
I do. 19 of those are in North Carolina, 2 in South Carolina, and it's largely rural area. So we have some challenges in serving our veterans in terms of access. And that's an area that we are focusing very much on, is that access to care.
Well, and tell us about the rural healthcare team, so to speak, or the mission that
Sure.
you have with the rural healthcare team. Obviously, southeastern North Carolina fits right into that mold of being extremely rural, and I know our viewers live in this area. So tell us about how that rural healthcare access team goes into action.
Our rural health team goes out into the community. The intent is to acquaint veterans with the services that we have and the services that they're entitled to. We enroll them, offer them an opportunity for an examination with a primary care provider, and then to receive care and services through the VA. Now, that may be at our outpatient clinic in Jacksonville. It might be in Wilmington, Supply, Hamlet, Robeson, or at the medical center itself. But it's an opportunity for education about health, education about veteran services, and the opportunity to determine if they would like to have their care through the VA.
Okay. Well, I know, and for our viewers, the Veterans Outreach Improvement Act is a bill that I had originally written and sponsored 2 sessions of Congress ago, and it passed 421 to nothing. You know, this day and time in Washington, it's rare to get anything to pass at all, but even more so when you have that kind of bipartisan support. But I think that bespeaks well of the understanding in Washington. It doesn't matter if you're Democrat or Republican. This is not a partisan issue. When we care for our veterans, we're caring for those who have served our country, who have fought for all of us as American citizens. And clearly that's the way veteran services as well as our armed services issues should be viewed. The Veterans Outreach Improvement Act, I know, passed Congress 2 sessions ago. It passed Congress again last session in the House. We've been waiting for our friends in the Senate to act on that bill, but it ties right into what you said of making sure that veterans realize the benefits available to them. I found that even with my own father-in-law that I mentioned earlier, when he originally started getting services, we did not realize at the time as a family, and I know he didn't, of all the opportunities that are available to serve veterans, many of whom may have assumed they may not be eligible or may have wrongly assumed that they couldn't access the system for some reason. I know our office wants to be involved in helping people do that, and we have folks in our district offices that specifically work on veterans issues and work with your folks on a regular basis. So we appreciate that work. In Brunswick County, we had a long battle down there. I know I went before the VA Cares Commission years ago to try to get a health clinic in Brunswick County. Many people said, oh, well, it won't ever happen. Then there was a concern whether it would happen because of the super clinic coming to Wilmington. But you and I shared 2 joyous days together, back to back, one in August, one in September. Tell us how you see the Brunswick County outpatient clinic serving and what services will be offered through that clinic with the growing veteran population down at the coast.
The Brunswick Clinic has just been received by the veterans with an incredibly warm welcome. Mm-hmm. We have a provider who's there full-time. We have a nurse, an LPN, and a health tech who are there full-time and are seeing our veterans. They're seeing them in supply, they're seeing them close to home, and providing primary care services. We also are providing through a telehealth mechanism mental health services. And our plans are to increase the footprint there so that we will have an additional team of providers just as soon as we see the enrollments reach the level in which we think a second team is needed. But with the reception, I don't think that's going to be too long.
Right. And I know when we had that opening day in August, there were some wonderfully designed, or I don't want to use the word decorated, but the way they were the vans that were used as shuttles to take folks to Wilmington or to Fayetteville if they can't get the type of extra attention they need medically on site and supply in Brunswick County, then they can go to Wilmington or Fayetteville. And tell us about the van service that's offered.
Sure. It's called the VTS, the Veterans Transportation System. And we were able in Fayetteville to get a large grant for 5 years in order to purchase vans and purchase ambulettes, so that we can transport our veterans from Jacksonville to Wilmington, supply to Wilmington, and then on to Fayetteville. And our plan for the future is that we'll also be able to continue on into Durham so that we can have that continuity. The intent is for the veterans who have transportation issues to have a reliable means in order to get to their clinic appointments. The intent is to help augment the DAV vans that we have that have been a tremendous backbone of transportation, so that our veterans can have ready access and to be able to have a comfort level that the vans will be available, they'll be available consistently, and that they can make appointments knowing that they're going to be available.
And the hours at the Brunswick Clinic, can you share the days and hours?
The Brunswick Clinic is open 5 days a week, but 4 of the days are for primary care, and that's from 8 a.m. to 6 p.m. Now, on the 5th day, we're bringing specialty services there. We have not put them in as yet, but what that will be very soon is our OEF, OIF coordinator. We will have a telehealth coordinator, an educator, and various services as that can serve the veterans in the area.
That's tremendous, and that brings us right into the Wilmington Super Clinic, which we broke ground on just as recently as September after a long, drawn-out process, but one that all the legal procedures we had to go through to make sure the contracts were in order, and we're excited about that. Hopefully to open by Christmas of next year. Tell us about the breadth and depth of services that we're going to have at that Super Clinic based in Wilmington.
The Super Clinic is well underway. We have seen already a lot of construction activity going on. We expect that the clinic will be ours about next October. It will take us about 2 months to outfit it. We plan to see patients there probably in December.
Right.
We will start out with primary care and move the Wilmington clinic that we have now that's very much outgrown its space.
Right, it sure has.
and move that over to the new Super Clinic. We will also have a women's health clinic, a pharmacy. We will have laboratory services, radiology services, and then we will have some special procedures. We will not house patients overnight, so these procedures will be day procedures, but will offer a tremendous increase in the amount of services that we can have, not only from Wilmington, but with our transportation system, we'll be able to bring patients down from Jacksonville too.
Well, and the full-service VA pharmacy, I mean, what a blessing that will be to folks, to know they can go right there to get issues with their prescription drugs dealt with. That in itself is marvelous, and then you add all the other services that, like you just mentioned, it really is exciting for there to be such a broad array of services there. Now, and also, as far as the Robeson County Clinic goes, are those services similar to what you described that are going on in Brunswick, or how do they vary?
Yeah, the Brunswick Clinic is primary care and mental health and some smaller additional services. We will not have the breadth of service at Brunswick that we will have
at Robeson?
I'm sorry.
At
Robeson,
yeah.
we have primary care and mental health, and we have hospital-based home care programs there.
Okay.
We will not have the breadth of services at Robeson that we have planned for Wilmington, but they'll have easy access to the Fayetteville Medical Center and then to the new Fayetteville outpatient clinic too.
So the Robeson Clinic is augmented by being so close to Fayetteville, and the Brunswick Clinic is augmented by being so close to Wilmington.
Correct.
So we have health clinics actually in those rural counties of Brunswick and Robeson, but yet each of them are very close to the larger, obviously, the clinic that's coming about in Wilmington or the VA Medical Center itself in Fayetteville. Tell us, when you mentioned earlier about the growing needs for mental health services, we know that PTSD or post-traumatic stress disorder has been a great concern and has gotten more attention. Tell me exactly what mental health services will be available to veterans.
Well, certainly PTSD is a concern for us, but we're also very concerned about the increasing number of homeless veterans, the increasing incidence of veterans who have postponed their mental health care because there have been so many deployments. And we have in each of our outpatient clinics a full complement of mental health services, either at the clinic itself or by using a telemental health process. And that is that there is a provider and a patient who are together at the clinic, but the expert is available through a tele-hookup that they can actually see the provider, have conversations with the provider, and provide specialized services that we would not otherwise be able to have in that location itself. So it's a real multiplier effect for each of our clinics and increases the access. And many of our veterans who are in the rural areas are very distrustful of large crowds. They're distrustful of traveling very far away from their homes. So this is an opportunity for them to get their very much needed services in a comfortable setting for them, and one that we think will be able to help them meet their needs.
Tell me about this. As I mentioned earlier in the show, we have folks in our offices throughout the district that try to work with veterans and meet their needs. One issue we've heard come up at the Wilmington Clinic currently has been the concern about no one being able to get through on the telephone. And that may sound pretty simple, but we've all had that frustration from one time or another trying to reach somebody, and we constantly call. And I think the real concern, as our office has heard it, has been that there's a waiting period, as you know, for veterans, that they're supposed to wait till about 10 days out before they call for a refill on their prescription, but then they get a little bit panicked or concerned if they start calling and 10 days, 9 days, 8 days, 7 days, and then they start feeling, oh no, is there going to be time to get my prescription refilled, and I still can't get through to somebody on the phone, and then they call our congressional office for help, which we welcome helping the veterans. Tell us though from your end, if or how that issue can best be addressed.
Sure. We recognize it and apologize for the frustration that our veterans have had. When the Wilmington Clinic was set up, the volume of patients and traffic that we were going to have was certainly not anticipated. What we are adding is 5 more trunk lines to the Wilmington Clinic, and that's in process right now. The trunk lines...
Is this for the current clinic or just the new one?
This is for the current clinic.
So that'll help in the near future?
Now,
okay,
yes.
Good.
The 5 trunk lines will be internal trunk lines that the staff at the clinics can use to call out, and what that will do is free up the call-in lines.
Okay.
So we should see immediate relief. But I would encourage the veterans to use My Healthy Vet and to log in through the computer system into My Healthy Vet in order to renew their prescriptions. Because it's readily available, they can do it at any time, either from a home computer or one that's located in a library or any of our veteran service organizations.
All right. Will you spell out or say exactly what that is? Is it the words My Healthy Vet?
Yes.
Okay.
It is.
And what else is added to that address? Is it at so-and-so or dot so-and-so?
You just go into the VA Gov system.
Okay.
And there is an icon for My Healthy Vet. And once one is enrolled in the My Healthy Vet, which you can do through the community-based outpatient clinic, then there is a password, and the individual can access their own records and order their medications, look at their medical records. And I think what's a new feature that I really would encourage folks to use is the secure messaging, so that a veteran can send a message to their provider at any time, and the provider will respond. And I think that will cut down on the number of phone calls and leaving messages that I know are very frustrating right now.
Well, I know being in a rural area, and to be very honest, folks who are the age, my father was a veteran, he passed away earlier this year, and my father-in-law, a lot of them may not either have a computer or regularly use a computer. So if they have recently gotten a computer or do use one, and they want to call somebody to say, all right, I'm willing to use a computer, but just explain to me how I set up this access, who would you suggest they call? The Wilmington office or somewhere else?
I would suggest that they come into the CBOC and let
Being the health clinic, when you say CBOC.
The health clinic, yes, the
okay.
community-based outpatient clinic, Wilmington, Supply, or Jacksonville. And one of the clinic folks will be glad to help them get enrolled and to walk through the process.
So they'll know how to access it on the computer. And can they also do that in Robinson or in Fayetteville?
Yes.
Okay.
Yes.
And then if they don't have a computer, though, they still can make the phone call, but you're going to have an increased number of phone lines that
Yes.
they could have someone talk to them in live time over the phone.
Yeah, they can certainly talk to them, but would really encourage the use of the computer. And we're trying to provide access across the generations, so that whatever media is most comfortable to the veteran is what we have available for use.
Well, and I want to remind the viewers too, our office is glad to assist in this. For those who have computers and are comfortable using them, we want them to get the ready-made service and to get it quickly that you can provide through the VA by computer. For those who are uncomfortable with computers or who may not be in a situation where they understand quite how to use the program, then we want them to be able to call our office or to call the VA clinic, which Ms. Goolsby has said, if you're closest to the Robinson Clinic, the Brunswick, or the Fayetteville or Wilmington, which are the 4 in our congressional district, and some of our folks do live near Jacksonville, although Jacksonville itself is not in our district, they could call any of those 5 offices really and talk to someone who can walk them through how to set it up on their computer. Or if they don't have a computer or are not comfortable with the computer, they could talk to a live person. Yes. So thank you for your attention to that. The other issue might be in Fayetteville, going back to the other end of the district, some people have called and are concerned about how long it takes to even get an appointment at the VA Medical Center in Fayetteville. Is there anything done to address that in terms of backlog or how long it takes to even hope to get an appointment there?
We were experiencing at the beginning of the year that we did not have enough providers to be able to serve the needs of all of our veterans. We have increased the number of providers that we have, and we are able to service veterans in less than 30 days. So by the time they put in an application, we verify the application, they will have an appointment within those 30 days.
Okay, good. That's Sounds like we're getting much better there. Well, I want to say thank you to Ms. Goolsby for being with us today, being here in Washington. I know your work, like mine, is primarily where it should be, back home in southeastern North Carolina. But we're both in Washington today, and this is why this is Capitol Conversations. We're coming to you live from here on Capitol Hill, and I want to thank you for your service that you give to our veterans. I want to thank all of our veterans and the families of those who have served and also those who are serving our country. We know we have a strong presence of Guard and Reserve in southeastern North Carolina, as well as active military, and of course, obviously, our veterans and our military retirees. You have stood up and you have fought for our country. You deserve every benefit that you have earned, and I believe that with all my heart, which is why we are thrilled to now have 4 opportunities. We've quadrupled our efforts for veterans health clinics throughout our region in southeastern North Carolina, and we're seeing dreams come true to serve our veterans. I want to make sure we continue to fight for our veterans. There are many issues. The Veterans Outreach Improvement Bill I mentioned earlier, to make sure veterans are aware of what benefits, and if you're a veteran and you don't know what your benefits could be, or you've never tried to access the system, so to speak, call our congressional offices, or we can help you get in touch with the VA, and you can have a face-to-face meeting with someone to help explain what your benefits might be. You can always contact our office on computer at mcintyre.house.gov, or you can obviously call any of our local offices in Fayetteville, Lumberton, the Brunswick office, which is in Bolivia, or in Wilmington. You also can access our office on Facebook and on Twitter. So whether you're faxing, phone calling, Facebooking, or tweeting on Twitter, or if you want to come by and see us. Or you can write us a letter the old-fashioned way. It may take a little longer the way the mail service is, but we are happy to work with our veterans and military retirees and anyone serving in our military. And for others who are watching today, we hope you'll share this with those that you may know who have served our country that may want to know more about their veterans benefits. Veterans Day is coming, and we certainly want to honor our veterans and remember the great service that they have given to our country, and of course continue to honor those who are currently serving in our military. I hope that you'll join with us again as we look ahead to future Capitol Conversations. We hope you've enjoyed this one today and have learned more about how we best serve those who have served our great country. Have a happy Veterans Day. God bless you, and during this season of Thanksgiving, know how thankful we are for the blessings we've received as a nation, and that we especially appreciate those who have served our nation.